Most people believe that L5-S1 disc herniations come from lifting something too heavy or severe traumas like motor vehicle accidents. The reality is those account for just a small percentage of L5-S1 disc herniations. The truth is, common postural problems that literally millions of people have are the result of the majority of L5-S1 disc herniations. Over time, these common postural faults overload the spine until someday down the road, one small move is that classic straw that breaks the camel's back, and that disc finally herniates and is damaged. In this video, you will learn 5 non-traumatic causes of L5-S1 disc herniations. 3 of these common causes you can actually identify at home just using your smartphone. You will learn how to spot them early and what you need to do to take care of your spine for life. Watch to the end and I will show you a free tool that you can use at home that's been developed by some of the top spine experts in the world to evaluate your posture and look for one of these very common non-traumatic causes of L5-S1 disc herniations. I'm Dr. Marc Dupuis, a corrective care chiropractor in Sanford, Maine. On my channel, you will learn how to optimize your spinal health and posture so you can feel better, move better, perform better, and have overall better health. You've heard it before, herniating discs in your lower back come from lifting something too heavy or being in a major trauma. While those things can happen, what nobody tells you is that most of the injuries that cause L5-S1 disc herniations aren't even significant traumas at all. The real cause is underlying postural problems that literally millions of people have and are walking around with every day and don't even know it. These postural faults put additional stresses into the spine in regions of the spine that are not meant to have additional forces, and then eventually all it takes is that cough or that sneeze, or we hear it all the time, I just bent over to pick up that empty laundry basket, or I bent over to put my socks on, and then the disc is herniated. So here's the scary part. These common postural faults often cause no pain until it's too late. So we're going to talk about what we can do to see if you have those problems now and how to take corrective action before big problems arise. But first, let's break down the most common postural problems that are silently putting your spine at risk. Problem number 1. Abnormal bends in the coronal plane. The coronal plane, otherwise known as the frontal plane, is what you see when you're looking straight ahead at me now. The spine should be straight up and down. The head weighs approximately 8 to 12 pounds in the adult, so almost picture a bowling ball being balanced on a broomstick. We want that spine tall, we want it straight. So what we have here, and you can see this with certain individuals, is we can have a list or a lean shifting to the right or to the left. And when we have that happen, what we're going to do is we're going to be putting significant pressure in regions of the spine where it's not supposed to go. What happens down here is the lower lumbar spines, particularly if we're leaning to the right, these right portions of the disc can be under a significant load. And if that's not corrected over time, the repeat bending and twisting that occurs can cause a failure in those fibers of the discs that are under additional pressure. Now here's the kicker. These coronal plane shifts or bends typically happen slowly over time. And often what happens is people do not realize it. You've probably all seen those folks at the grocery store that have a significant lean one way or another. Well, all large curves or bends started off small. People that are like this, no one told them many years ago when they were just starting to lean. So what happens is the lower you go in the spine, the more weight builds up. So that's why L5-S1 is particularly at risk when we have these postural faults. Other common signs that we have asymmetry in the coronal plane can be seen when we look at shoulders. If we see a drop shoulder, if we see a head tilt one way versus the other way, if we look at hips and we see a hip tilting one way or another way. Now, a small imbalance may not look like much, but it's the weeks, the months, the years where that additional load is going to be transferred into those lower discs. And that's why something that seems innocuous can be a big problem when we don't realize the hundreds of thousands of repetitions we've been putting on a spine that's been already under excessive load. The next common postural abnormality that can put you at risk for an L5-S1 disc herniation is a more severe abnormal bend in the coronal plane, and that is known as a scoliosis. So a scoliosis is any curvature that's greater than 10 degrees, and a scoliosis is never just a pure side bending issue. There's also rotation involved. So it's a three-dimensional displacement of the spine. So you can imagine the amount of abnormal force that's going to be put on our discs if we take a spine that's supposed to be straight, throw a side bend, and also rotate, and then do all of the normal activities that we do throughout our 5 to 10 to 15,000 steps per day. There's no surprise to see how scoliosis deformity can lead to disc herniations. Now, the next common displacement is something that looks like a scoliosis, but is not a true scoliosis, and that's an abnormal curve that's a compensatory curve that is trying to balance out a short leg. Now, what most people don't know, and even some doctors don't know this, is that upwards of 90% of the population has a short leg. Now, what happens is if the average short leg is around 4 millimeters, it's at that particular amount of difference, 4 to 5 millimeters, that researchers suggest is enough to cause symptoms. Now, there's something known as the righting reflex. If our pelvis is tilted one side or the other due to a short leg, you're not going to let yourself walk around crooked. Your brain wants your eyes level with the ground. So if we have a short leg causing a pelvis tilt, we will get a compensatory curve or set of curves to try to ultimately get those eyes level. Now, obviously for these individuals, they need to be assessed properly and have their leg length addressed with the use of an intervention like a foot lift to correct the leg length and then improve the position of the spine by removing the need to put in that compensatory curve. Now, if someone does have a leg length inequality or there's a suspected leg length inequality, it's critical that you see a healthcare provider who's been adequately trained to actually identify and accurately measure that leg length inequality. As corrective care chiropractors, we're trained in using a specialized x-ray known as a modified Ferguson A to P view. And when we set the patient up according to strict parameters, we're able to accurately measure the height of the legs. There's also a scan that some hospitals use, and that's called a scanogram. But anything other than those two things cannot accurately measure the lengths of legs. Some providers will try to do spot checks by looking at how people's legs look when they're on the table, but you can have muscular imbalances, you can have other rotations, they might not be in squares. It's highly inaccurate, and there's no data to suggest that visualization outside of x-rays is accurate enough to make proper adjustments to correct true leg length inequalities. Now we're going to shift to the side view. When we look at the spine from the side view, there's three very important curves. This guy's a little beat up, but we should have a lumbar lordosis, followed by a thoracic kyphosis, and then a cervical lordosis. One common cause of added stress in the lower back is a loss of the lumbar curve. We call that a flattening of the lumbar curve. And then what you'll see is these facet joints are supposed to bear a good third or more of the weight of the upper body. If you take that nice shock absorbing curve and we straighten that out, two things happen. We're going to transfer more weight into the discs, putting additional load that they are not designed to handle. And then we are removing that nice shock absorbing curve. So when we lose that shock absorbing curve, instead of the curve distributing the weight of the upper body, now those tissues have to absorb it. That can put a tremendous amount of load into the discs, combine that with all of the bending, lifting, twisting that we do throughout the day, and that can put the discs, particularly L5-S1, at a high risk of herniation. So this is why your curves matter. And again, as corrective care chiropractors, we use research-supported techniques that actually have been shown to restore the normal lumbar curve over time. In many individuals, we can improve the curve enough. It might not be perfect, but it improves enough to where it can start returning those shock absorbing qualities to the spine. And many of our patients can become pain-free, and they can maintain that pain-free status for years afterwards, because the body really is designed to have those curves in that lumbar spine. It's supposed to be a lordosis, so anything we can do to improve or restore that lordotic curve will be helpful to the spine long term. Now we're going to look at the exact opposite of a hypolordotic lumbar curve, is an excessive lumbar curve. So many people can have a pelvis that dumps. They have an excessive lumbar curve. We can see how that can bring those spinous processes much closer together. We can get a jamming of the facet joints and a jamming even at the spinous process tips. And then here as well, we are putting more load than there should be at the posterior aspect of the disc. If we do that over time and continue to bend, to twist, to lift, to reach, you can see that we're going to put that disc, or those discs, and particularly L5-S1, at a high risk for herniation. Now, as if that wasn't bad enough, in severe cases, what can happen is, if there is damage to particular aspects of the vertebra themselves, we can actually have slippage of the vertebra forward. That's called an anterior listhesis. And if this vertebra, or this vertebra, or this vertebra were to slide forward, that can put a tremendous shear pressure on the disc. People talk about discs slipping. They don't really slip. They're sewn into the vertebral bodies, the end plates above and below, by these special Sharpies fibers that come down at certain angles. So those discs are sewn into the vertebra themselves. So if you take two vertebrae and shear them with an anterior listhesis, that's going to create significant damage, which can in many cases result in herniation. So there you have it, 5 common postural faults that can put additional loads onto the discs, ultimately leading to a future herniated disc in the lumbar spine. We have abnormalities in the coronal plane. We have scoliotic deformities. We have leg length inequalities causing compensatory curves. We have flattened lumbar curves, and we have excessive lumbar curves. Now we got to talk about what to do about these different things. We already mentioned leg lift correction. That's pretty easy. You need to find someone that's adequately trained in identifying the leg length inequality and measuring the specifics of that inequality, and then prescribing a proper lift that will help to level that pelvis and then reduce that compensatory curve. Now, how about for a simple home tool that almost everyone has that we can use to look for signs that there may be some of the other abnormalities present, and that's simply a smartphone. Grab a smartphone, put it on video or picture mode, and take some postural pictures. You can have someone take some 5 or 6 steps like they're marching in place. They can do that with their eyes open, with their eyes closed. They can take some deep breaths and snap some shots. And look, do we see level ears? Do we see level shoulders? Do we see level hips? It's very often, once you take a moment, we can see, hey, do we have any abnormal bends or leans in the coronal plane? If we see significant dropped shoulders and hips and low ears on one side, then hey, there could be a scoliotic deformity present. We'll talk more about a specific app for that. And then also, when we look at the person from the side, a lot of times those that have an excessive curvature will kind of see the pelvis dump and the belly will translate forward, shoulders kind of come back. So if we see that posture where pelvis is translating forward, kind of belly's out and shoulders back, there's a good chance that we have excessive curve. And then typically when we lose our lumbar curve, it's not unusual to have what's considered flat back syndrome, relatively flat all the way up. When you see those people, we almost see, hey, there's almost like no line from the back right down to the butt. They're almost like too flat. And that can be an indication that we have some abnormalities in the side or sagittal posture. Now, the next step in looking at one's posture, if you want to turbocharge it, there's an app made by the great researchers over at ScoliCare, and it's called the ScoliScreen app. So if you look up on a Google, ScoliScreen app, it's not an app like an iPhone app. It's an app that you access through the web, but you can access this through a smartphone or a tablet, and that will have a program that will let you take a picture of an individual, and then it will walk you through a number of steps, checking different portions of the anatomy, and then it will give you a risk factor if this individual is at high risk for scoliotic deformity. So a Scoli Screen is an advanced free app designed by the spinal experts over at Scoli Care, and anyone can use that, and that can be very helpful in determining if someone is at risk for the scoliotic type deformity. Now, when it comes to what do we do about the coronal leans or bends or scoliotic deformity or loss of a lumbar curve or a hyperlumbar curve, that's where corrective chiropractic really shines. So how I like to explain it is traditional chiropractic care, it's like traditional dentistry. Should you brush, floss, see your hygienist, check in with your dentist? Yes. It's good for your teeth, it's good for your health. Traditional chiropractic care, where you lie on a table, you get checked for what we call subluxation, spinal segments that are stiff or stuck, not functioning well. An adjustment is provided to restore normal motion. It's good to do, it's good for your body, it's healthy. But if you have a dental problem that's caused by misaligned or crooked teeth, does brushing, flossing, and seeing the regular hygienist or regular dentist more frequently fix crooked teeth? And the answer is no. If you want to fix crooked teeth, they have to send you to who? The orthodontist, right? Where they apply braces or Invisalign, which apply pressure to teeth over time, and then teeth will shift or move. It's not rocket science, you just have to take the time to do it. So when someone has an actual spinal deformity present, adjustments are helpful. They can provide temporary relief, but they do not restore correct posture. Why? Ligaments connect bones. And when ligaments have lost their normal alignment, you have to do specific therapy that has been shown to help change the anatomy, change the length of those ligaments. And that's what the essence of corrective care is. As corrective care chiropractors, we use a combination of mirror image exercises, mirror image adjustments, and then we apply traction in the vectors that are required to move that spine, to change the ligament lengths, to allow the spine to move closer to where it's supposed to be. Because structure determines function. If you've lost your normal structure, you will not function well. In this case, we're talking about abnormal function leading to abnormal loads on discs, which can lead to disc herniations. So if we can restore or improve spinal alignment, we can better distribute forces, and then we can better help those discs to do what they're designed to do, allow for normal movement, absorb normal amounts of load without herniating. So that's really what sets chiropractic, or corrective chiropractic, apart from traditional chiropractic. And in order to make these adjustments, in order to prescribe the traction and the exercise and the specific mirror image adjustments, you have to x-ray. That's why I'm in the x-ray room here. You'll see our x-ray unit, some examples of cervical spine degeneration. If you don't x-ray, you're just guessing. There are countless forms of spinal deformity that you just can't see. We don't have x-ray vision, so x-ray is absolutely critical. And of course, it's not just any x-rays, but we use standardized x-ray procedures, so we can say with high degree of certainty that what we see is what the spine is actually doing. And this is backed by over 40 years of peer-reviewed research. The corrective chiropractors have been producing over 300 peer-reviewed publications in a variety of rehabilitation journals. So then the next logical question is, well, where do you find a corrective chiropractor near you? And this answer is easy. You go to the website, www.idealspine.com. You can put in your town or your zip code. You can search for doctors worldwide. So if you are not close to Southern Maine, we are located in Sanford, Maine. Hop on that www.idealspine and look for a corrective care chiropractor near you. So we covered a lot in this video. Take time, rewatch it numerous times if you have to. Share this video with people that you feel may benefit. Now you know many of the non-traumatic causes of L5-S1 disc herniations. How do we look for signs that we might have some of these postural deformities? What do we do about it? Take action now before those discs herniate so you can have lifelong spinal health, move better, feel better, perform better, and have overall better health. And last but not least, you know how to find corrective care chiropractors. I talked about the www.idealspine.com website. That is the home of chiropractic biophysics, which is the most research supported corrective chiropractic care technique in the world. Drop a comment below if you have any questions. I take the time to read each and every one of them. If there is more specific information you are looking for, put that in the comment section as well too. Take a minute to watch the next video, 3 safe and easy effective exercises to do for L5-S1 disc herniations.